Okay, good afternoon. Good afternoon. Okay, today we will discuss about a topic called walking aids or mobility aids. Okay, so walking aids or mobility aids. So any idea about the walking aids or mobility aids? So normally we can speak about mobility or walking aids. So aids means AIDS, something which is assisting or supporting to achieve the walking or mobility. So other name for walking we can say as a mobility or a mobilize. From mobilize means shifting from one place to another place. Okay. So the term walking aids or mobility aids is saying that it's a device or an external appliances which helps or which supports or which assists throughout the walking or mobility. Is it clear about the introduction or about the definition of the walking aids? So when and all we need a support from the walking aids. Any idea? When and all we need support from the walking aids, we need to prescribe the walking aids to the patient. Any idea? During various pathological conditions. During various pathological conditions. So if we seeing in an orthopedic condition, so after an injury or after a road traffic accident or after a trauma, so the orthopedic surgeon will go either two type of treatment. So one type of treatment is a conservative treatment, which includes plaster of Paris cast. So it is a POP cast. So another way of treatment is surgical intervention. Depends upon the area involved, depends upon the type of injury or depends upon the type of fracture. They will go for the lateral screw fixation or some other metal implants. Yes or no? Yes or no? So after that procedure, either conservative or surgical. So after that, what they will prescribe to physiotherapist means we have to teach like non-weight bearing, or we have to teach like partial weight bearing, or we have to teach like full weight bearing. Why means if government take a case scenario or a case example, the patient have met an accident followed by they have a leg both bone fracture. They have a leg both bone fracture. So they went for a orthopedic surgeon and they implemented a surgical management where they make a metal implant surgery where lateral screw fixation done for that patient. So after the surgery done, suddenly shall we go for a full weight bearing walking for that patient if the right side is affected? Shall we go suddenly for a full weight bearing walking for that patient? So what will happen? What will happen? What will happen? So the metal implantment goes for malfunctioning or it will tends to affect the healing purpose. Yes or no? It will tend to affect the healing purpose. So gradually we have to progress. So first initially they will say like a non-weight bearing activity or non-weight bearing day, followed by from non-weight bearing we have to progress to the partial weight bearing. From partial weight bearing we have to progress to the full weight bearing. So like that they will prescribe for physiotherapy department post orthopedic condition. If it is a neurological condition, so in neurological condition due to any diseases or any pathological issues, there will be a effect of nervous system which leads to affecting the motor function of the either upper limb or lower limb, which tends to affect the walking pattern or mobility pattern. So in order to prevent that, if assume the case example, patient having a hemiparasis. So hemiparasis means one side upper limb and lower limb weakness. So for them, without a walking aids, is possible for the patient to walk or possible for the patient to mobilize from one place to another? No. So in the type of condition, we have to go with the support of mobility aids. Yes or no? So similarly, in cardiovascular. So in cardiovascular, any idea about cardiovascular? So do you hear about the surgery called coronary artery bypass grafting due to the coronary artery disease? So it is like a so name is bypass. So in order there is a blockage in one particular artery, they will replace that artery by taking a graft from femoral artery or femoral vein, that's a lower limb. So if the number of blockage is more, so like 2 block, 3 block, 4 block, so they want to take a number of artery and veins should be a lengthened one. So they will take from thigh region till leg region. So after taking the graft only, they will replace the blocked area. So after following that, the patient is able to put full weight bearing. Assume that the same case scenario, patient with the 130 kg of weight or 140 kg of weight, patient followed by taking the graft from the femoral artery or femoral vein. They start from the thigh region till the leg region. Is patient able to weight bear, or is patient able to walk after that without any assistive devices? Is any possible or any abnormal will be there? because of more body weight, there will be a swelling or edema collections will be there. So in post-operative cardio also, we need a assist of mobility aids or walking aids. Okay, so like that, we have to select the walking aids depends upon the patient condition and depends upon the patient need. Okay, and also depends upon the gauge pattern. So like gauge, for example, gauge means whether they want to go with a 2-point gauge or a 3-point gauge or a 4-point gauge. So it depends upon that, we have to select the walking aids. So in the walking aids, there may be crutches, there may be cane, there may be sticks, or there may be a walker. Okay. So is it clear? Can you down or any suggestions? Thank you.